Originally derived from the Greek word plastikos, meaning to mold or reshape, plastic surgery is an amazing profession which adapts surgical principles and thought processes to the unique needs of individual patients by molding and reshaping human tissue. Unlike other fields of medicine, we don't have a defined organ system or a particular set of procedures. It's more of a point of view or a bag of tricks with the goal of solving problems. The ultimate objective of plastic surgery is the creation or the restoration of the best form, function, or structure of the body in order to maximize quality of life.
Dr. Rhodes is a reconstructive pediatric plastic surgeon. I met her about 4 years ago, shadowing her in the operating room. Sculpture comes from the Latin word sculptura, meaning to sculpt. In its most basic definition, it is a three-dimensional art concerned with carving, casting, or molding. But it is also one of the oldest and the most innovative forms of the visual arts.
Morgan Yacoe is a working sculptor. Her interest really lies in the nexus between art and medicine. We've been collaborating together for about 4 years now, and we spent a lot of time talking about the similarities in our two fields and in our perspectives.
So before I actually came in and saw an operation, I thought that surgery was this dry and formulaic profession, but I couldn't have been further from the truth. Surgeons are constantly innovating and improvising, and each person has their own unique anatomical traits, so surgeons are constantly being challenged. Actually, the first surgery I saw Dr. Rhodes perform, she was repairing a little 2-month-old baby who had a cleft lip. And I remember the first thing I noticed Dr. Rhodes do before she did anything else was really observe this baby's face. She was really thinking about every anatomic detail, the same way that I would approach a sculpture. But then I noticed, I could see in her movements and her eyes that she was thinking about every perspective of the face. I could tell she was thinking about symmetry, she was thinking about lighting, she was thinking about form and color, just as I would approach a sculpture. Same way, same way. And then, but then I realized that there was this whole other element. This baby was only 2 months old, and it had years of growing and maturing to do. So this added a whole other dimension to the surgery. It was a living sculpture in my eyes. And that right there was a turning point. So through seeing surgeries, I really began to have an understanding of the materiality of the body, its textures, its colors, its layers, its depths, something that I could have only begun to understand through this exact setting. So then I continued to come in and shadow Dr. Rhodes, and we sort of developed this dialogue about where our two perspectives met.
So one of our earliest collaborations was, it involved a set of conjoined twins that were separated at VCU Medical Center a couple of years ago.
So what I did for this operation is I took a casting of their bodies and I created a medical sculpture used for pre-surgical planning. So after this operation, the twins were successfully separated, I was really inspired by this experience and I wanted to create a sculpture. So I had the actual mold of their bodies in my studio, and I just thought it was this beautiful form. So I took it and I created a bronze sculpture of it. And I wanted to create the sculpture not only to commemorate this incredible surgical feat and that just completely changed these girls' lives forever, but I also wanted to show how art was used throughout this process. I wanted to really highlight this intimate space where the girls were actually conjoined. So after this experience, I have continued to create medical sculptures for other surgeons and other doctors, and it has continued to really inspire and inform my work in the studio.
Plastic surgery really blurs the line between art and medicine, and to be a skilled plastic surgeon, you need to be creative, flexible, curious, and have a good understanding of human psychology as well as anatomy and physiology. And as someone who's really heavily vested in trying to train the next generation of plastic surgeons at VCU, I think about how do we nurture these qualities in our trainees while they're undergoing this incredibly rigorous training process that we know stifles their creativity and their empathy and promotes cynicism and detachment. In my opinion, nothing is needed more than nourishment for the imagination. In medicine, like all areas of science, imagination and creativity are what distinguish excellence. And I believe this is doubly true for plastic surgery, the problem solvers of the surgical world. Unfortunately, the prevalent attitude in today's medical culture is one of cynicism. And this has a tremendous impact on doctors in training as far as their attitudes and behaviors. To give you an idea of the scope of the problem, there was a study published in 2011 in the Journal of the American Medical Association that found over 50% of our doctors in training are burned out. Over 50%. Having that high level of stress, we know impacts their ability to interpret their medical knowledge. We know that it decreases their empathy. We know that they become less engaged in the learning process. Critical thinking and creative problem solving really suffer. The problem is even more acute in the surgical fields, where the evidence is mounting that our trainees suffer from unacceptably high rates of emotional exhaustion, depersonalization, and a poor sense of accomplishment. In my opinion, nothing is needed more than nourishment for the imagination, both to reinvigorate the learning process, but also to nourish their creativity. I've been thinking for a long time about how we can create a meaningful educational experience that is both relevant to the field of plastic surgery, but also interesting, hands-on, and novel. So one day while Morgan was watching me in the operating room, I asked her if she'd be interested in helping to create a workshop, basic sculpture skills for the plastic surgeons in training.
So I said yes, and I got to work. Surgery touches on the many fundamental artistic principles that I'm really familiar as somebody who studies art. So I got all the residents into an art studio, and I gave them a bag of clay and an armature. And in the center of the room, we had a model. And I wanted to teach them really how to observe the figure. I wanted them to look at the figure from multiple different perspectives, think about ratio, like the overall form, angles of the body. So they started to work, and I could tell that each of them just brought this incredible level of focus and intensity to their work.
Surgeons.
And it was really inspirational, and just to see them sort of create these sculptures from scratch and to learn all these things, I could see that it gave them a true sense of self-accomplishment, and it really sort of ingrained these techniques within myself as well.
I was surprised at how quickly the residents were able to assimilate the artistic concepts that we were teaching. I was also surprised with how naturally they interacted with the clay. They immediately understood how this was relevant for their training, and they really seemed to enjoy trying something new. They were both enthusiastic and engaged, which was exactly what we were going for. This was fantastic. We had succeeded in invigorating the learning experience, but we had also enhanced their understanding of complex anatomy. It turns out having a sophisticated understanding of anatomy and physiology is an excellent base from which to integrate these artistic concepts. It also turns out, as you'd expect, surgeons are visual and tactile learners by nature. So creating a hands-on experience which weds the creative and the factual is a natural fit for this group.
So we realized that we were onto something and decided to get to work to create a full semester-long course.
Our current collaboration is called The Art of Reconstruction. And the idea behind this class is to introduce the plastic surgery trainees to the practical skills of drawing and sculpture. We're also going to investigate aesthetic principles and question accepted canons of proportion and beauty. Once they have absorbed a basic understanding of form, shape, spatial relationships, and contour, they're going to be really able to quickly integrate this knowledge into their aesthetic sensibility, and that's what guides their surgical judgment. We've even designed specific modules to really bring home how these concepts are relevant to common plastic surgery situations. One example of these modules is trying to help them understand the challenge of creating a symmetric breast for a woman who's lost one of her own to cancer. Another module that we have is going to allow them to practice some basic plastic surgery techniques that we use in reconstructing the face of someone who has had a skin cancer excision. If our goal is to encourage inspired problem solving and true innovation, we have to teach our students to be confident in their creativity. Combining the knowledge and the perspective of the medical sciences and the fine arts is a powerful combination. Plastic surgeons, like sculptors, are called on to solve a seemingly endless variety of problems.
In both of our fields, we have this adaptable set of principles as tools that need to be applied both creatively and skillfully to each unique situation.
The Greek word plastikos suggests the flexibility of being open to new ideas and perspectives, molding them and reshaping them in an ever-changing relationship with the world. Creativity and imagination are fundamental for excellence in any discipline.
So, no matter what field you're in, step out of your familiar environment. Be open to the value of other perspectives. Really take the time to nourish your imagination and embrace collaboration.
These are all absolutely necessary ingredients to achieving true innovation and advancement. Thank you so much.